So this case is a patient that I did surgery on about 6 weeks ago. I did a partial knee replacement on him. And he's approximately 40-year-old patient who had pain for a long time, as you'll hear from him in a second, and had a failed surgery. Had gotten to the end of that recovery, and the other doctor had just said, hey, there's nothing more we can do. He had an allograft procedure, which is not a bad necessarily surgery to try, but in his case it wasn't effective because he had arthritis on both sides. So we reviewed his case in detail and decided that the only real treatment for him would be a partial knee replacement. We did that 6 weeks ago, and he's doing great. I'll let him let you know himself.
Yeah, well, I've been dealing with this pain for probably 13 years now. I had one surgery back in '09, didn't really do anything. About 2.5 years ago, I had another doctor did a surgery on it. It got way worse after that. I was constantly in pain, probably scale of 8 to 10 on the scale of 1 to 10, constantly, sometimes even more. I couldn't go a full day of work. Usually 5 or 6 in the evening, I was done. Couldn't do no more for the day. But 6 weeks after this surgery, 1,000 times better. Highly satisfied. Just getting the full range of motion back still. It's just a little stiff, but as far as pain, there's no pain. It's just slight swelling and some stiffness. That's it.
So partial knee replacements are really good options for younger patients who have significant arthritis, symptoms that aren't responding to conservative management, and who are at the end of their rope. You don't want to do the big total knee replacement, and so oftentimes you can do a partial knee replacement and still to get them really good range of motion, pain relief, keep them very functional. You can do higher levels of activity with a partial knee replacement compared with the total, and the recovery is faster. His range of motion already is 120 degrees, and as I said, he's only 6 weeks out. He's still swollen, that's normal, but I thought it would be helpful for you just to see his case and see how quickly it is possible to get better. 13 years of pain resolved with one surgery. Super thankful. He's done his homework, and I think he'll have a long time before he has to do something else.